Welcome back, and thank you for joining us. If you are over 60 or caring for someone who is, today's discussion could change the way you think about one of the most common foods in your kitchen. For thousands of years, garlic has been respected as a powerful healing plant. Ancient civilizations used it to fight infections, strengthen the body, and protect the heart. Even today, modern research connects garlic to improve circulation, immune support, healthier blood pressure levels, and reduced inflammation. Because of this, many older adults make garlic a daily habit, adding it to meals, eating it raw, or even using it like a natural medicine. But here's the part that often goes unspoken. Garlic is not just a flavor. It behaves like a biologically active compound inside the human body. In other words, it doesn't just nourish, it acts. And after age 60, the body processes powerful compounds very differently than it did decades earlier. The stomach lining becomes more sensitive. Digestive enzyme production naturally declines. Blood vessels grow more fragile. Liver detoxification slows. Kidney filtration becomes less efficient. And most seniors begin taking one or more daily medications. All of these changes mean that something beneficial in small amounts can become overwhelming in larger amounts. Something that supports circulation can increase bleeding risk. Something that stimulates digestion can irritate the gut. Something that lowers blood pressure can push it too low. This doesn't mean garlic is bad. It means garlic is powerful. And powerful things must be used with awareness. In today's video, we're not here to create fear. We're here to bring clarity. You'll learn the most common garlic mistakes seniors make. Mistakes that can quietly stress the stomach, interfere with medications, or create discomfort without people realizing the cause. Most importantly, you'll learn how to use garlic in a way that supports your body, respects your age, and maximizes benefits while avoiding hidden risks. Because when it comes to health after 60, the goal is not intensity, it's balance. And often, the difference between healing and harm comes down to three simple factors: dose, timing, and personal tolerance. Let's begin. Mistake 1. Eating raw garlic on an empty stomach. One of the most common health habits among seniors today is eating raw garlic first thing in the morning. Many believe it cleans the blood, kills germs, or detoxes the body. But what sounds natural isn't always gentle, especially after 60. Let's look at what really happens inside your digestive system. Raw garlic forms a powerful compound called allicin when it's crushed or chewed. Allicin has strong antimicrobial and circulation-boosting properties, but is also chemically sharp and irritating to delicate tissues. When garlic enters an empty stomach, there is no protection, no food buffer, no fiber, no healthy fats, no protein. That means the sulfur compounds in garlic make direct contact with the stomach lining. And here's the key issue for seniors. After age 60, your stomach's natural defenses decline. The protective mucus layer becomes thinner. Blood flow to the stomach lining reduces. Acid control becomes less stable. Tissue healing slows down. So the stomach becomes much more sensitive than it was decades ago. When raw garlic hits that unprotected surface, irritation can start quickly. Common symptoms seniors report include a burning sensation below the ribs, stomach pain that comes and goes, nausea shortly after eating, acid reflux later in the day, sour taste in the mouth, feeling of heat in the chest, bloating or heaviness after meals. Over time, repeated irritation can contribute to gastritis, chronic inflammation of the stomach lining. And here's something important. Many people mistake this burning feeling for the garlic working, but irritation is not cleansing. Inflammation is not detox. Garlic also stimulates gastric acid production. For someone with GERD or acid reflux, this is like pouring fuel on a small fire. The acid can move upward into the esophagus, causing heartburn hours later, often without the person connecting it to the morning garlic. Another overlooked factor is the nervous system. The stomach communicates with the brain through the vagus nerve. Strong stimulation from raw garlic can trigger dizziness, sweating, or lightheadedness in sensitive seniors. There's also the gut bacteria issue. Garlic has antimicrobial effects, but high concentrations on an empty stomach can disturb beneficial gut bacteria balance, sometimes leading to gas or digestive discomfort later in the day. The good news? You don't have to stop eating garlic. You just need to change how you eat it. Garlic is far gentler and still effective when eaten with meals. Food acts as a cushion. Fats slow absorption. Fiber reduces irritation. Meals containing olive oil, nuts, seeds, fish, or cooked vegetables create a protective environment where garlic's helpful compounds can be absorbed without attacking the stomach lining. Lightly cooking garlic also reduces harshness while preserving many heart protective benefits. Portion size matters too. One small clove mixed into food is very different from swallowing multiple raw cloves like medicine. Garlic should support digestion and circulation, not shock the stomach. Your body heals best with steady nourishment, not aggressive exposure. Garlic is powerful, and powerful things must be used wisely. Mistake 2. Thinking more is better. Garlic has earned a powerful reputation in the world of natural health. It supports circulation, immunity, and heart function. But here is the part many seniors never hear. Garlic behaves like a natural medicine inside the body, and every medicine has a dose. 1 small clove used in cooking is food. 3, 4, or more cloves every day, especially raw, becomes a pharmacological effect. After age 60, your systems are more sensitive to strong biological compounds. The liver processes substances more slowly. Kidneys filter more gradually. Blood vessels lose elasticity. The margin between helpful and stressful becomes smaller. One of the biggest effects of garlic is on blood clotting. Garlic reduces platelet aggregation. That means blood cells are less likely to stick together. In moderation, this can support heart health and circulation, but in excess, it can make the blood too thin. Older adults naturally have more fragile capillaries and thinner skin. When clotting is reduced too much, the body struggles to stop small bleeds. Signs this may be happening include bruises appearing without remembering an injury, purple or blue spots on arms and legs, frequent nosebleeds, bleeding gums while brushing teeth, cuts that take a long time to stop bleeding, heavier bleeding after dental work. Many seniors don't connect these symptoms to garlic because it's just food, but biologically, garlic sulfur compounds act similarly to mild blood-thinning agents. Now consider medications. A large percentage of people over 60 take aspirin, warfarin, clopidogrel, or other blood thinners. Adding large amounts of garlic on top of these can amplify the effect. That increases the risk of internal bleeding, which may not be obvious until it becomes serious. Garlic also influences blood pressure. It relaxes blood vessels and improves blood flow. That sounds positive, but too much can push pressure too low, especially in seniors already taking hypertension medication. Low blood pressure symptoms often include dizziness when standing, feeling lightheaded after meals, sudden fatigue, blurred vision that clears after sitting, weakness in the legs, feeling faint in warm environments. These episodes increase fall risk, one of the greatest dangers for older adults. Another area affected by excessive garlic is the digestive lining. Garlic stimulates digestive secretions and bile flow. In small amounts with meals, this helps digestion. In large amounts, especially raw, it can irritate the stomach and intestinal lining. Over time, this may contribute to gastric discomfort, burning sensation in the abdomen, increased acid reflux, worsening of gastritis, greater susceptibility to ulcers in vulnerable individuals. There's also the issue of liver workload. Garlic contains sulfur compounds that the liver must metabolize. In moderate amounts, this can support detox pathways. In excess, it becomes an additional burden on an organ that already slows with age. The immune system can also be overstimulated. Garlic activates immune cells, but chronic overstimulation may worsen inflammatory or autoimmune tendencies in sensitive individuals. And then there is nutrient balance. High garlic intake can interfere slightly with ion absorption in some cases and may change gut bacteria balance when consumed in large raw quantities daily. The key lesson is this: The body thrives on gentle consistency, not intensity. Traditional diets use garlic as a flavoring agent mixed into meals, not as a high-dose daily supplement. A small clove cooked into food provides circulation support, antimicrobial benefits, and antioxidant effects without overwhelming your systems. But turning garlic into a daily medicine dose without medical supervision can stress the very systems you are trying to protect. Natural does not mean unlimited. After 60, resilience is different. Recovery is slower. Balance becomes more important than potency. Garlic works best as a steady helper, not an aggressive treatment. Mistake 3. This is one of the most important safety points for seniors. After 60, very few people are medication-free. Blood pressure pills, heart medications, diabetes drugs, cholesterol reducers, pain relievers, these become part of daily life. Now here's what many people don't realize. Garlic is biologically active. It changes how the body handles chemicals, including medications. Inside the liver are enzyme systems responsible for breaking down drugs. Garlic sulfur compounds can influence these enzyme pathways. That means medications may become stronger, weaker, or last longer than intended. Let's look at the biggest risks. Blood thinners in garlic. Garlic reduces platelet stickiness and has mild anticoagulant effects. When combined with warfarin, aspirin, clopidogrel, or newer anticoagulants, the blood can become too thin. This raises the risk of internal bleeding, stomach bleeding, easy bruising, bleeding in the brain after a fall, prolonged bleeding from minor injuries. Seniors already have more delicate blood vessels. Even small changes in clotting can have bigger consequences than in younger adults. Blood pressure medication and garlic. Garlic naturally relaxes blood vessels and lowers blood pressure. This is beneficial in moderation. But when someone is already taking ACE inhibitors, ARBs, calcium channel blockers, or diuretics, the combined effect can push pressure too low. Low blood pressure isn't harmless. It can cause sudden dizziness, weakness, blurry vision, confusion, falls, which are a leading cause of serious injury in older adults. Diabetes medications and garlic. Garlic can improve insulin sensitivity and reduce blood glucose. Again, helpful unless blood sugar is already controlled by medication. Then levels can drop unpredictably. Low blood sugar may cause shaking, sweating, rapid heartbeat, mental confusion, fatigue, loss of balance. Many seniors think they are just tired, not realizing their blood sugar dipped. Cholesterol medications. Garlic can influence how the liver processes statins. This may alter drug levels, potentially increasing side effects like muscle pain or reducing effectiveness. Pain relievers and anti-inflammatory drugs. Combining garlic with NSAIDs like ibuprofen or naproxen increases stomach irritation and bleeding risk. Surgery and dental procedures. Doctors routinely advise stopping garlic supplements 1 to 2 weeks before surgery. Why? Because even natural clot-reducing effects can lead to excessive bleeding during procedures. Many people don't tell their doctor about garlic because it's just food, but concentrated intake acts more like a drug. Supplements versus food. Garlic capsules, extracts, and oils are much stronger than cooking garlic. One capsule may equal several cloves. These concentrated forms bypass the body's normal food-based buffering and create more powerful physiological effects. Food-level garlic used in meals is gentler. Supplements require medical awareness. The key principle is consistency and communication. If garlic is part of your daily diet, keep intake steady. Don't suddenly double it. Always inform your healthcare provider if you regularly consume large amounts of garlic or take supplements. Your medications are carefully dosed. Even natural foods can shift that balance. Garlic can be helpful, but only when it works with your treatment plan, not against it. Mistake 4. Damaging garlic through cooking errors. Garlic's benefits depend on how it's prepared. Burning garlic destroys beneficial compounds and creates irritating ones. Deep-fried or charred garlic produces oxidized sulfur compounds that stress digestion. At the same time, swallowing large pieces of undercooked garlic can overwhelm the gut, especially with slower enzyme production in seniors. The right method. Crush garlic. Let it sit 10 minutes. This allows allicin to form. Then cook gently on low heat in olive oil. This preserves benefits while making garlic easier to digest. Mistake 5. Ignoring gut sensitivity. Garlic contains fructans, fermentable fibers that many seniors cannot digest well. Those with IBS, bloating, SIBO, or slow digestion often react strongly. Symptoms include gas buildup, abdominal pressure, cramping, sudden urgency, feeling heavy after meals. Garlic intolerance increases with age because gut motility slows and enzyme diversity decreases. Garlic-infused oil offers flavor without fermentable fibers, making it gentler. Mistake 6. Using garlic as a cure-all. Garlic is powerful, but powerful does not mean all-powerful. One of the quiet dangers among health-conscious seniors is believing that a natural food can replace medical care. Garlic supports the body. It does not substitute for diagnosis, monitoring, or treatment. Garlic can help circulation, but it cannot open a severely blocked artery. It may support immunity, but it cannot control a serious bacterial infection. It may mildly lower blood pressure, but it cannot manage advanced hypertension on its own. The difference matters. After age 60, many health conditions are not just functional. They are structural and progressive. Arteries stiffen. Pancreatic insulin response weakens. Kidney filtration declines. These are physiological changes that food alone cannot reverse. Garlic works gradually and gently. Medications are designed for targeted, measurable effects. When seniors stop or reduce prescribed medications because they feel garlic is doing the job, several risks arise. Blood pressure may quietly climb without obvious symptoms until dizziness, stroke, or heart strain appears. Cholesterol plaques continue forming even if numbers look slightly improved. Untreated infections can spread deeper into the body before garlic's mild antimicrobial effect makes any difference. Diabetes complications develop silently while blood sugar control fluctuates. Another issue is delay in seeking care. Someone may tolerate chest discomfort, shortness of breath, or prolonged fatigue, believing garlic will clean the blood. But these may be warning signs of heart or lung conditions that require prompt evaluation. Garlic supports resilience. It does not correct emergencies. There is also a psychological effect. Natural remedies can create a sense of control, which is positive. But that confidence must be balanced with medical reality. Health after 60 is about integration, not replacement. Think of garlic as a helper, not the hero. It supports blood vessel function, digestion, and immune balance. But medications, imaging tests, lab monitoring, and professional guidance address deeper disease processes. The safest approach is partnership. Garlic alongside a nutrient-dense diet, regular movement to maintain circulation and muscle, proper hydration to support kidneys and metabolism, adequate sleep for repair and immunity, prescribed medications taken consistently, routine checkups to catch problems early. This combination is where long-term health lives. Food builds a foundation. Medicine handles repair work. Neither one should be asked to do the other's job alone. When garlic is seen as part of a complete strategy rather than a miracle fix, it becomes what it truly is, a valuable daily support of health, working quietly in the background while proper medical care handles the heavy lifting. Conclusion: garlic is powerful, but aging bodies need gentleness, not intensity. The right amount nourishes circulation, immunity, and heart health. Too much stresses the stomach, blood vessels, and medications. The secret to longevity is not extreme superfoods. It is steady habits, balanced choices, and listening to your body's signals. Let garlic be a helper, not a hidden strain. If this information helped you see garlic in a new light, share this video with someone who uses garlic daily. It could protect them from a mistake they didn't even know they were making. Thank you for watching, and here's to making every choice a little wiser, one day at a time.